We are at the downtown campus for Orlando Health, and we are honored to be joined by Dr. Arnaldo Velez today, who is a vascular neurologist here. Welcome, Dr. Velez. Thanks so much for being here.
Thank you for having me.
People have a lot of choices when it comes to healthcare. What is it about stroke care at Orlando Health that differentiates it from other hospitals?
Great question. We have the best vascular neurologists in the area. We have the best neurosurgeons in the area. We also collaborate very well with our sister facilities to make sure that the stroke care they receive anywhere in the Orlando Health system is the best care that they can get.
All right, Darlene, so you have a patient in here. What's going to happen now?
So we call a stroke alert overhead, and then the stroke team responds to the bedside. At which time the primary ED nurse gives handoff to our stroke responder, Mallory.
Okay, perfect. How old are you guys at? You know what the month is right
She
now?
actually just gets a history from the patient and then starts her NIH assessment to determine the level of severity of her stroke so that she can report that off to the physicians when they come in.
This is a stroke response team, and it is completely original.
We actually implemented that in 2005, and they actually come to the bedside and start the process, and they facilitate the whole stroke alert process. They do the NIH stroke scale. They facilitate the movement of the patient in a timely manner so that we're keeping everything on track so that we can get treatment to the patient as quickly as possible.
So in addition to be fast, so we can identify the signs of stroke as quickly as possible, you also use the NIH stroke scale. What is that and how does it work?
Correct, yeah, it's very similar to BFAST, however it gives a little more detailed information of what's happening with the patient. And it goes from a range of 0, which is a normal patient, to 42, which is a devastating stroke. And it gives us an idea of where the location of the stroke, depending on the symptoms and signs that they have, and what we need to do along the care pathway to treat these patients.
What kind of outcomes are you seeing now versus even a few years ago?
Yeah, so the outcomes that we have and currently experience in our hospitals are getting better all the time, but it's as much as important from our perspective as the patient's perspective, making sure that they get in time to allow us to do what we do best and treat stroke patients. But yes, we're seeing many more patients going home rather than going to a nursing home or a rehab facility.
In so many cases, they can go back to having a perfectly normal life.
Completely normal lives, yeah.
Yeah. For more information, visit orlandohealth.com/stroke.